I think we finally reached a breaking point.
You need to opt out of your insurance plan. Don't even bother with the rate increase. Just get out.
People are not going to get health insurance this year and following years.
CVS Pharmacy had a total revenue this year of about $400 billion.
America is not nearly as upset as we should be about the state of our healthcare situation.
Our healthcare is going to triple next month, but all of our tax-paying dollars went over to Israel to pay for their free healthcare. Free!
I think these health insurance companies are banking on Americans being too afraid to go uninsured.
So many people that work within the insurance industry said cancel it. They confirmed that it's a racket.
I'm a doctor and I'm really concerned about what's going on with healthcare premiums and healthcare insurance right now.
For decades, the deal was simple. Pay your premiums every month and in return you get peace of mind. But that safety net has been replaced by a multi-trillion-dollar toll booth. We are watching a silent strike unfold across the country. Working Americans are opening their enrollment packets, staring at premiums that rival mortgage payments and deductibles that would bankrupt them anyway. So they are simply opting out. They aren't doing this carelessly. They are doing it because the math no longer works. When a routine clinic visit is cheaper in cash than the copay with a major insurance plan, the system isn't just broken. It is actively extorting the people it claims to protect.
Our insurance premium is set to triple or more than triple in the new year, and it's not affordable. Who has an extra $1,500 to just spend? And again, that's just the premium. It's also a $15,000 deductible. So it doesn't even kick in until we reach $15,000.
That's more than a mortgage payment. How are you supposed to afford health care? Fortunately, we are healthy. We do take good care of ourselves. But anything could happen at any time. And you just have to figure out how to deal with that. Unfortunately for us, we're choosing to not have health care.
I think we finally reached a breaking point. I just had a meeting with a company about adding on DPC and Zion instead of them going with traditional insurance. And they are telling me that their traditional Blue Cross Blue Shield health coverage for 2026, they just got the rates, and it's going to be $900 a month per employee. That's just the employee, that's not their family. And that's going to be for a plan that has a $9,000 deductible, $50 copays for primary care, and $100 copays for urgent care or for specialists. So that's completely wild. I think that we are finally getting to the point where people are like, no, like, absolutely not. We're not going to pay that. That's insane. And I think that's really where we need to be for things to start changing. So they reached out to me, and they are most likely going to be adding DPC and Zion Health Share for their employees. And I think they're going to be much happier for it. Instead of spending $900 a month on coverage that's absolutely terrible, they're going to be spending about $250 a month for amazing service and amazing healthcare.
I'm a senior benefits analyst, and I want to share some resources for those who need healthcare. If you don't have insurance, or even if you do, save this video, and I'm so serious, because everyone needs access to affordable healthcare. The first one is completely free Remote Area Medical, RAM. They are a nonprofit. They have pop-up clinics that offer an array of free medical, dental, and vision benefits. So pap smears, glasses, dental work, prescriptions, and much more. These are real medical professionals that are basically volunteering their time to help out the community. You can find schedule and locations at ramusa.org/schedule, and be prepared to arrive early, because as you can imagine, free resources, everyone wants to take advantage of those. And some people might even come early and camp out, but it's worth it. Community health centers offer health services to the uninsured. There are going to be copays, but they vary, and they're likely going to be low cost or income based. You can find one near you. Just Google it and call to ask about pricing before actually booking. Dental hygiene schools or dental schools offer very discounted or even free cleanings, fill-ins, extractions, checkups, etc. This is a great resource. If you don't have dental insurance, I've used it myself. With Amazon Prime, One Medical gives you access to doctors and prescriptions if you don't have insurance for less than $100 a month. This is usually telehealth, but if you live in a place where they have physical locations, then you can always go in person. GoodRx also has the same kind of membership. Theirs is called Minute MD. Another option is to find out the cash amount of the service that you're trying to get, because sometimes it is cheaper to pay cash per instance instead of paying for health insurance monthly. Some doctors don't always take insurance, but they do offer a membership. So you would pay maybe $80 to $150 a month to get access to the doctor, depending on the terms that they outline. This is called direct primary care. So just look it up to find if there's any offices that offer this near you. Also, $150 a month is way cheaper than any insurance that you will find right now. Vision is usually pretty cheap, but every penny counts. Student eye institutes usually offer discounted or even free prescriptions, glasses, and optical exams. Sam's Club also has good eye exam and glasses packages. And if you already have the prescription for your glasses and you just need to order the glasses, you can get this for a discounted price on Zenni.com or Zlaw.com.
CVS Pharmacy had a total revenue this year of about $400 billion. They're projecting it to be even higher for next year. Walmart Pharmacy, $46 billion. I work in home health care and I also do patient advocacy. And I couldn't help but thinking when I was reading this that the amount of patients I have come across in home health care who literally are not taking medications because they can't afford them. The one that comes to mind right away is Eliquis. Eliquis is a life-saving medication. This is something that you have to take in order to avoid blood clots, stroke, etc. So you're telling me there's a good portion of the American population who cannot afford medications like Eliquis, yet the pharmacies are having record-breaking revenues in the billions. I will never stop saying that the American healthcare system is a for-profit scam that is ripping off every single American. And we all get caught up in politics and we all get caught up in all of the different things. But what we pull back and fail to realize that the only people who are benefiting from our healthcare system are making billions of dollars. Certainly not the people who are sick and needing the help.
I know good and well that the government did not just say that our healthcare is finna triple next month, but all of our taxpaying dollars went over to Israel to pay for their free healthcare. Free! They have free healthcare. We paid for it. I know we did not give them free healthcare for our healthcare to triple, and it's already high.
I don't even know where to start with this video because I just opened up this letter in the mail and I was like, oh my God, I need to get my emotions on camera because this is wild. This is insane. So, health insurance. I pay $150 a month. Not bad, honestly, for just myself. I don't make a ton of money, very average. So that is where I would like to stay. Now, I got a letter in the mail a month ago, a little 6 weeks ago, that said your premium will probably go up $100 plus in the new year. Okay, so I was prepared for that. What I was not prepared for was opening up this letter from Anthem, my insurance, with my new monthly premium. Any guesses? Right now's your chance. Let's hear it. What's your guess? How much should it go up by? Now this is where it gets hilarious. Hilarious, okay? Because my new monthly premium is $686.38. But wait, I get a little bit of financial help. I get a little bit. You want to know how much? It's a good one. It's a hilarious joke, actually. I get $1. $1. Oh my God, what am I gonna do with all my savings? $1. So I will have to pay $685.38. Lucky me. Honestly, why even put the dollar? That just feels offensive at this point, you know? It goes on to say financial help. This part includes any subsidies. We've heard that word a lot recently. You qualify for that lower your monthly health plan premium. What's been going on with the subsidies lately? Yeah, are we f***ing great yet? Because I don't feel great. And I'm gonna probably live this year without health insurance and just hope for the best. Take my vitamins, be careful. I don't know. This is bullshit. Let's do the math real quick before I leave you. $685.38 times 12, so you have to pay that every single month. You're looking at $8,224 for the whole year. And that's just to pay, just to have insurance, just to say, hey, I have it, just in case something happens. I mean, if I'm just a middle of the road person who can afford basic necessities and go about my day and live kind of financially cautious and do okay, and this is a problem that I feel like I can't afford, I cannot even imagine what it is like for families, especially anyone below the poverty line, people that are already struggling, people that already have medical debt that they can't pay off. I mean, this is gonna have serious repercussions. Like, this is going to be a domino effect. People are not going to get health insurance this year and following years, and people are not going to pay their medical bills when they do have to go in because they're going to be so high that they can't afford them, so they just don't pay them. And then hospitals are not going to get paid, doctors, all that stuff, like, they're going to end up shutting down. Like, do we not see the streamlining of these consequences of, if you do not take care of the people and their health and make sure that we are all okay, that is going to have rippling effects on everybody. And it makes me really sad. It makes me super, super sad. I am kind of scared amongst many other things, but this is not what I wanted to see this morning.
I think these health insurance companies are banking on Americans being too afraid to go uninsured. They've turned that fear into a business model, selling peace of mind that actually doesn't cover much whenever it's needed. That's right, they're selling fear. Fear of bankruptcy, fear of the what ifs, fear of the unknown. So many people are stuck paying outrageous premiums and outrageous deductibles because of this fear. And then when you finally do need care, guess what? That safety net is full of holes. Most people are staying insured due to fear and not faith in that system. Because deep down, we know that if we drop that coverage, we're vulnerable. But on the other hand, if we keep it, we're still not safe. Premiums go up and coverage goes down, and they profit out of our hesitation to walk away. They've convinced us that any insurance is better than none. But what if the real risk isn't being uninsured? So start asking questions, start shopping around, and stop letting your fear fund their profits.
There is no scenario in which Republicans are going to vote on a bill to extend ACA credits. There is no scenario in which Republicans are going to agree to a Democrat-drafted healthcare bill, because Project 2025 has already mandated them to overhaul or eliminate ACA altogether. So we need to be looking for what's next. What do you do if you lose your healthcare in 2026? There are direct primary care companies that allow you to pay a monthly membership in exchange for a certain number of doctor's visits per month. The cost ranges anywhere from $50 to $150 per month on average. And some companies allow you 4 visits, some companies allow you 2. It just depends on the company that you go with. You can also do technology-based memberships with companies like Alpha Medical, or if you want to dance with the devil, Amazon's company One Medical, that also allows you to pay a monthly membership in exchange for a certain number of visits to the doctor. That might not be the best option for you if you have a chronic illness that's managed with expensive medication, but it may be something to look into. But it's a really good option for people who only go to the doctor a couple times a year, who maybe only go when they get an infection and need antibiotics, or they go for a well women's exam or their annual physical. These are good plans to look into. If you're faced with a hospitalization and you don't have health insurance, check with the hospital to see if they have charities that help to cover your expenses. It's not a perfect plan, and it's not going to fully replace your regular healthcare insurance, but it's something to look into if you are worried that you're not going to have healthcare next year and you're worried about what that might mean if you get sick.
America is not nearly as upset as we should be about the state of our healthcare situation. Just in Italy and Switzerland for 3 weeks, and my boyfriend met me there halfway through my trip. And, he has this medical thing going on where it comes and goes. Sometimes it's an issue, sometimes it's not. When it raises its ugly head, he goes to the doctor, gets a prescription, and gets his medicine, and he's all better in 5 to 7 days. So when it reared its ugly head again, we were in Italy, Florence and Pisa, and he's freaking out. He's calling his doctor trying to figure out how he's going to get his medication that he needs to feel better and function. Because in the US, it requires a doctor visit and a prescription and then a visit to the pharmacy, and the doctor has to call in your prescription to the pharmacy, and then you wait, and the whole thing costs, what, $400 or $500? So we're in Florence, and I said, babe, why don't you see that building over there that says Pharmacia? Why don't we go over there and see if they have what you need? Because we know what you need. We don't need a doctor visit. We just need the meds. He's like, no, there's no way. They're never going to give it to me. I don't have a prescription. I haven't seen my doctor. I haven't been, referred to them. I'm just a guy off the street. I said, honey, but that's how universal health care works in other countries. I know you've been growing up in this dysfunctional wasteland that is America, but it doesn't have to be this hard, and in the rest of the world, it's not. So he resisted it for a day, but by day 2, he was really suffering. So I finally prevailed upon him to go to the Pharmacia. So he goes online, takes a picture of the meds that he needs. He still has not heard back from anyone in the United States, by the way. Left several messages, called his doctor, cannot get in to see a doctor, cannot get the prescription. He's suffering. We walk over to the Pharmacia, lovely Italian lady behind the desk. We show her a picture from the internet of the drugs that we need. She nods, goes back to a drawer, opens the appropriate drawer, brings the meds back, shows them to him. It's in English. We can read it. We know exactly what it is. It even has the little Pfizer logo in the upper right-hand corner. It's made by Pfizer. It's the exact same stuff he uses in the United States. It's a miracle. How much could this possibly be? 10 euros. 10 euros. Because the dollar's so weak, that's about what, $12.50? It would have cost him $400 in the United States. He would have had to have gone to see the doctor, paid the copay for the doctor visit, gotten the prescription, waited, gone to CVS, gotten the prescription filled, and it's like $180 in the United States to get the prescription filled, and a whole shitload of rigmarole. And he pays a ton for insurance, too. This is all covered by his insurance. Imagine if it was just out of pocket in the US. 10 euros. America, we are not nearly angry enough about the state of affairs.
What the is going on with health insurance? Like, are there any regulations with health insurance anymore? Like, the shit that I'm seeing now on a regular basis is just getting wilder by the day. Right, I just had a patient recently that I put in a prescription for testosterone, and I got a notification back from the patient that said the insurance isn't going to cover. This is a well-known insurance, Anthem, Blue Cross Blue Shield. They said they will not cover the testosterone through the pharmacy, even though I did the prior authorization, even though it was indicated. And then after they denied it to the patient, they contacted the patient later and said, hey, you can buy this testosterone from our online pharmacy for $20. And the patient was like, okay, how do I do that? And the pharmacy tells them, no shit, just put it under your husband's name and we'll cover it, $20. I didn't put a prescription into their online pharmacy. I put it into the pharmacy here. I didn't put a prior authorization in for that. That's a controlled substance. What is happening? That's shady. That's shady, right? That's shady.
Cancel your health insurance. That's the answer. I've had the best health insurance for so many years. Since it's open enrollment, it is showing that I have to pay over $2,000 a month on health insurance. So I decided to actually do my homework for the first time because everyone has this scare like I need health insurance. And so I called the clinic where I have to do 4 scans every single year, and I wanted to know, what do you charge me cash if I had no insurance? This year I just went like 2 months ago, and the total cost was $465 that I had to pay out of pocket. I'm like, okay, maybe this is like a $15,000 service and I'm only getting it for $465. That's amazing. Want to know what it would cost with no insurance? The total is $550. Literally less than $100 difference. Meanwhile, I've been paying like $1,500 a month on health insurance. Just now it's going up to $2,000 because it's open enrollment. I called all my other doctors to see, do you take patients that don't have health insurance? They're like, yeah, of course. Some of them didn't want to give me their pricing until I said I might lose my health insurance and they had no option. I called primaries, gynecologists, pediatricians, eye doctors, the whole nine. Every single one of them, less than about $150 per visit. Health insurance is a scam. Get rid of it.
Tank health insurance stock. Tank it. You know how we're going to tank it? We're not going to purchase health insurance during open enrollment. We're not going to purchase health insurance. We're going to do cash pay. We're going to set up programs with hospitals and clinics and doctors' offices to pay our bills through the office. We're not going to use insurance to go see the doctor, to buy prescriptions, or to get blood work. We're going to work around the system ourselves. It's possible, we can do it, and that will ensure us that they will lose stock in their healthcare companies overnight. It's the only way to get some kind of leverage and piss them the fuck off, because all the shit they do to us, seriously.
Pulled the trigger. I canceled my ACA healthcare starting at the first of the year, and I am moving forward with a health share for our family. We decided on Zion over New Health, just simply because there's more people involved in that. Even though I liked New Health better, this is just my first foray into this world, and I kind of wanted to have the security of a share that had lots of members. And then we also have another friend that is using Zion too. So that is what we are doing. I cannot believe that I canceled my health insurance. Like I said, it was going up to $2,500 a month for a family of 4, healthy, no problems, nothing. Me, my husband, and 2 kids. So, yeah, rather than that, we are now doing, I think it's the 2,500 IUA, and it's something like $380 a month. And hopefully we never have to use it and we continue being really healthy. Because this is insane. I cannot believe how stressful this has been. I cannot believe that this is America. I mean, I can completely believe it, like, duh. But it's just so insane. And I've been so traumatized by dealing with health insurance over the last, 4 years between 2 pregnancies and births. I swear, if the unlikely event that I ever got pregnant again, we would be going to any other country nearby to have this baby.
Yeah, I would rather be paying a second mortgage on a home somewhere. Instead, I get access to health insurance that will cover my family after we pay another $10,000 per individual or $20,000 per family in our out-of-pocket, like our deductible. So if you add that up, that is what, $36,000 a year plus an additional $10,000 to $20,000 in potential payments that we will be making out of pocket.
Why aren't we all canceling our health insurance en masse? I want you to stop and really think about that. Because when you break it down, the entire concept of modern health insurance in America has become a form of state-sanctioned financial abuse. Most of us are already stretched thin, some to the breaking point, paying through the nose for shit-tier coverage that seem designed specifically to avoid paying for anything. You're hemorrhaging hundreds, sometimes thousands of dollars per month from your paycheck. And for what? For the privilege of having a $8,000 deductible? So if you get sick or break a bone, you still end up with a 5-figure medical bill because the ambulance was out of pocket and the anesthesiologist was out of your network and the hospital doesn't take your specific type of plan. Spend the entire year paying for nothing. And then the clock resets on January 1st and you get to start the whole financial grind all over again. If you think it's bad now, buckle up because we're headed off of a cliff. Premiums are already projected to skyrocket 15 to 20% on average. That's baseline increase. Now layer that on top of the Republican Party's goal to dismantle the Affordable Care Act and obliterate the subsidies that make insurance even remotely accessible for millions of people. They get their way at the end of this government shutdown. We're not talking 20% increases. A lot of people's premiums will triple or even quadruple. Average total annual cost for a family of four's employer-sponsored health insurance is projected to be nearly $27,000. For a family buying on the marketplace, you're looking at an average premium of $950 for bare bones bronze plans to over $1,300 for a gold plan. And that's before you even step into a doctor's office and start chipping away at the deductible. Now I ask you, is the average family of four without any major chronic health conditions using $27,000 worth of medical services every year? Are they getting $27,000 of value in their care? I fucking doubt it. The entire model is built on the healthy minority subsidizing the system, while the insurance companies skim a massive profit off the top and fight tooth and nail to deny as many claims as they can. It is, in its purest form, a scam. The cost of prescriptions are a scam. The billing is a scam. It's all a house of cards built on our participation. This entire multi-trillion-dollar system cannot survive without our money. A critical mass of people stood up and said, no more, and canceled their policies in a coordinated act of financial defiance, the system would implode very quickly. And that implosion would force the system to operate differently. We're already seeing a rise in concierge medical services and subscription-based medical services. Doctors and hospitals are often just as trapped as we are. Insurance companies don't just screw the patients, they screw the providers as well. They dictate what a procedure can cost. They force doctors to accept reduced payments and then bury them in mountains of bureaucratic paperwork. An independent practice is forced to slash the price of a service just to be in network. What do you think happens? The doctor has to see more patients in less time to keep the lights on. It becomes a revolving door. You get 5 minutes with a physician who is staring at a computer screen, not you. And then the quality of care plummets because the entire profit model is perverse and broken. Insurance companies have inserted themselves as a necessary parasitic middleman, making themselves rich by making both the patient and the doctor more poor and miserable. Our collective financial power is our ultimate leverage. It's the same principle as the mass cancellations of Disney and Hulu that brought those corporations to their knees when they overstepped. They cannot run these insurance scams without our premiums. Our money has always been, will always be our power. Our compliance is their fuel. If we collectively pull the plug on this extortion racket, we can force a seismic shift. And it's time that we stop begging for crumbs of reform from people who own the bakery. It's time we burn the whole bakery down and build a new one ourselves by starving the beast that feeds on our fear and finances.
So as of this morning, healthcare.gov, the Affordable Care Act, has published what their pricing is going to look like for plans in 2026. And yeah, it's pretty catastrophic to say the least. So you can go on healthcare.gov right now. You can view the 2026 pricing. Basically, you enter your zip code and some information if you want, and they'll pull up plans that are available in your area through the healthcare.gov marketplace, through the Affordable Care Act, right? So you can look at those prices and you can also compare them to the 2025 prices. So I went on there, entered my zip code because I was curious as far as what our healthcare.gov premiums are going to look like next year. And let me tell you, they want $430 a month for a bronze plan with a $9,000 deductible. This is an HMO, meaning you can't even go to that many providers, and it has a $9,000 deductible at $430 a month. And this is for a bad health insurance plan on the Affordable Care Act. Not a gold plan, not a good plan. This is a bronze HMO, not a PPO, a bronze HMO. I'm going to put it on the screen right now. $9,000 deductible, $430 a month, meaning to get basic coverage through the Affordable Care Act, this plan does not include dental. You would have to pay $430 a month. And then if you actually needed to use your health insurance, you would have to spend upwards of $9,000 to receive benefit from your health insurance. It's seriously incomprehensible that is where we're heading with health insurance, because Republicans refuse to fund the subsidies necessary to keep the Affordable Care Act going at a reasonable rate. So yeah, if you're on the Affordable Care Act, you're pretty much looking at healthcare plans that are starting at $400 plus a month. And this is for myself, who lives in a low cost of living, medium cost of living area in Texas. So I don't even want to know what this looks like for someone living in Boston or NYC or LA or other high cost of living markets. I mean, I couldn't even imagine. And this is for a bronze plan, y'all. Health insurance in our country is fundamentally broken. And there's really not anybody fighting for significant reform. There are Democrats fighting to maintain the subsidies, which is great, but what we really need in our system is significant reform. We need a universal healthcare system, and we need to stop debating with private healthcare providers on whether or not they're going to provide health insurance and healthcare to the American public. Healthcare is a right. It should be guaranteed. Everyone should have health insurance or healthcare provided through the government, through the public sector, completely funded, just like Social Security, Medicare, Medicaid. And that should extend to everybody. You shouldn't have to go on the Affordable Care Act website and pray that you can afford a public plan through healthcare.gov, and also pray that that plan doesn't increase by 20 to 30 to 40 to 50% in price, because Congress refuses to continue to improve your health care.
We dropped our health insurance for 2025. I've seen a lot of people are considering that for this year. I know that prices are jumping up, and I know that's really scary. Let me tell you what we did. Let me give you just a few tips that will make your life easier if you decide to go this route. Step number 1 is find a direct primary care clinic in your area. We pay $265 a month for all 7 of the people in my family to have direct access, 24-hour text access, call access. All of our visits are covered. Telehealth is covered. Yearly labs are covered. Basic testing is covered. We pay that to a direct primary care clinic. We have utilized medical services more this year than we have in a very long time because we can afford it now. Another thing that I think is really important is to shop around for the best prices. If you know something coming up that you need to have done, there is actually a law where hospitals are required to show transparent pricing on their websites. Every single hospital in the US is supposed to have a tool on their website where you can calculate your estimated costs. And if you are self-pay, you usually get a drastic discount. So look for those cost estimator tools at your local hospital so that you can see which area you're going to find the best pricing in. Obviously, if you're in a rural area, you are probably going to be a little bit more limited. But bigger cities are probably going to have a lot more competitive pricing, and you can kind of shop around for where you're going to have your procedure done. Another tip, and this might sound silly, but be healthy. Make healthy choices. Eat well. Stay hydrated. Obviously, emergencies come up. We have not had anything super severe happen. We have had medical issues come up. We have done self-pay for all of them so far. But if catastrophe strikes, there is help and there are options. Hospitals offer assistance. You can use Care Credit, which is a credit card with 0 interest as long as you pay it off within a certain amount of time. That is strictly for medical costs. Listen, I don't feel like people consider dropping their insurance if they don't struggle to pay for it. So for us, instead of paying $1,200 every single month and the deductibles and everything out of pocket that our insurance wouldn't cover, this just made more sense to us, and it's worked really well for us this year.
Okay, I'm going to hop on a soapbox for just a couple of minutes and tell you why I, a physician, do not have health insurance in the traditional sense for my family this year. Last year was frustrating enough. $17.50 a month for my family of 5, cheapest plan available on the healthcare exchange, just wanting truly catastrophic coverage, HSA eligible, with a $4,000 deductible for an individual, $8,000 for family. and probably a copay after that for a high out-of-pocket max. So we were spending over $20,000 a year, and unless something bad happened, we're getting really nothing. Preventative care visits for my kids, but my wife and I pay cash to wellness physicians, and so really we're not getting much. It was there just for emergencies. Well, this year it went up another $200, close to $2,000 a month, and I just couldn't stomach it. Paying $24,000 a year, and then having to pay $4,000 or $5,000 more to hit a deductible before there was any true benefit. That's insane. And I won't go down the rabbit hole of what I've seen in my private practice in terms of markups and lab costs, but just didn't sit well. So I contemplated going totally uninsured, just self-insuring, putting aside $1,000 or $2,000 a month just in case something happened. I chickened out on that, but we did short-term insurance. So it's a 3+1, so a 4 total month short-term medical insurance, and it's truly catastrophic only. But at most, $5,000 out of pocket if something bad happens, if there's a hospitalization, and so much easier to stomach. We still pay for our own primary care visits if we use them, so we'll have to pay for kids' pediatric visits, but that's really the only thing we're using it for. After that, we're going to do a cost sharing program. So there's a secular one called Sedera, I believe. And that's my plan for the remaining 8 months. And that's for $600. They will cost share anything over $5,000. You pick what number you're comfortable with. So you can have a lower amount, but you pay more per month. But that's kind of what we decided. And so then we'll be covered. And even factoring in dental visits, pediatric visits, everything, we'll still save $13,000 this year. So this system's broken. Something's wrong with it. I just need to vent for a minute.
6 months ago, I had my 4th baby without insurance, and basically I've just been sharing with you guys how much it's cost to have a baby without insurance. So if this is the first video you're coming across, just watch the playlist and then that'll get you caught up. But we got an update. I got another letter from the hospital. Random. Didn't know I was getting this. This is not something that I've called and been like, hey, can you make this lower or blah, blah, blah. The only time I talked to somebody was 2 weeks after I had the baby. They called and were like, hey, we noticed you have insurance. Do you want to apply for any assistance or whatever? And I was like, no. I applied for CanCare or whatever when I first found out I was pregnant, knowing I was probably going to get denied. And I got denied for it. And they were like, oh, okay, yeah. Well, you probably, if you got denied for CanCare, you're going to get denied for this assistance or whatever. Well, anyway, the last video was talking about how I had got a letter from the hospital basically saying that the financial assistance program had picked up part of my bill. And at that point, the final total was $4,927. Well, now I just got another one. And it says my previous balance was $4,927. The charity discount is $3,449. So my remaining balance owed is $1,478. So, I don't know. That's a good thing, I guess, but it's just so weird how I just keep getting these letters and I haven't talked to anybody. And even since the last one, I haven't set up anything outside of my regular payment that I have set up online. So, yeah, I probably need to do that. I really do need to talk to somebody. But anyway, just a little update. It's gone from 16 to 20, 16,000 to 20,000 to 4,000. Now it's down to 1,500. So crazy.
How can I help you today?
Yeah, I just got out of the hospital on Tuesday, and it's my Aetna app is saying that I had a prior authorization request for my hospitalization that was denied. And I'm wondering why, because my kidneys were failing. So, hello?
Yes, I'm checking.
Okay.
So the denial reason was that you didn't meet the requirements for coverage.
I mean, I wasn't really even given a choice to be hospitalized. I mean, you know how that goes, right? You go into the hospital, they tell you you're sick, you have to spend the night, right?
I see here that there is a peer-to-peer offer that is an opportunity to the provider contact and schedule a peer-to-peer and provide all the necessary information about the medical necessity.
Okay. Is that like already scheduled, or is that something I have to try to arrange?
No, that is the doctor.
So if I went into an emergency department and I was admitted to the hospital, I saw like 8 doctors. Who's the doctor that does the peer-to-peer?
He is the provider on the authorization, so he is the one who needs to make the peer-to-peer.
Okay, I'll see if I can fit. He's a hospitalist, so I mean, he doesn't work at the hospital full time. So I mean, I have no way to contact him. Is it a nurse that makes this decision?
Yeah, in this case, is the peer-to-peer option.
So a nurse never looked at this?
Yes, it did, but again, they only determine a decision with information they have. That's why they are offering the peer-to-peer.
I understand. Can I speak to the nurse? Can I speak to the prior authorization nurse that made the decision? And provide more information?
Number for them.
They said that I could call and try to set up a peer-to-peer, and I don't really know how to request that.
So there's not anything we can do on our end. You do receive a bill from us for this data service. You can always call in and see if there's anything we can do to help you get that covered by insurance.
Okay.
But as of right now, there's just nothing we can do. Thank you for calling in. I hope you have a great day.
I got the email today. We're all waiting for it, right? We all know it's coming. We want to inform you in advance so you can prepare yourselves. We don't have the numbers yet, but your health insurance is going to go up. We're trying to minimize the damage, of course, but do be prepared to pay more next year than you paid this year. How bad do you think it's going to be?
I'm about to crash out over my health insurance. So when I was on maternity leave, I got my hours cut down to what's considered part-time, 24 hours a week, and I lost my health benefits. My husband and I are both self-employed. In my other job, I'm self-employed as a therapist, so I don't have insurance options. My husband doesn't have insurance options, so I worked a job essentially just for the insurance, and then they cut me out my hours down to part-time. I looked at the marketplace today, and we don't qualify for any subsidies. So insurance for our family of 5 would be $2,500 a month. I'm not paying $2,500 a month. I'm fine paying cash because we don't go to the hospital, but I looked at a hospital catastrophic plan. I don't qualify because we make too much money. I have no idea what to do. So find me working at Starbucks 20 hours a week with a master's degree because I need health insurance.
Our family will not be enrolling in health insurance this year. Nada. I had a hysterectomy in April. I started seeing my gynecologist last September, knew that this was the plan. I have 2 insurances. One is Cigna. That is my employer provided health insurance. I pay $76 a month just for myself. If I were to pay for my family, hence why we have the second insurance I got through the marketplace that is Better. So I am double covered. Okay. In case you did not know, this is for you insurance people because this is why I'm mad. Cigna would be primary. Why? Even if you had Better longer, it doesn't matter because it is a government subsidized individual healthcare plan. Employer plans are always before the government subsidized plan no matter what, okay? Had the hysterectomy done in April. I had to call and do a coordination of benefits once. I already had to do this. I had the hysterectomy in April. They called me in June and needed me to do a coordination of benefits and tell them Cigna is primary. Dealt with it. It's been handled. Get a call this morning from the gynecologist's office that Cigna is now calling and wants their money back. They want my gynecologist to send the money back that they already paid because they're saying again that Better was primary because I've had Better longer. Now I've worked in insurance for a hot minute and I am currently finishing my medical billing and coding degree, and let me tell you, I was ready to make the phone call and go to war. After an hour-long wait, I still haven't spoken to anybody. I had to call Cigna, and then they had some secondary company called like Coventry or something like that that they had to call and argue with. And they said, oh, there was a lapse in your coverage, it looked like, back in May of last year, and so you've had Better longer. And I said, I left my job for a month and I came back. But it doesn't matter how long I left. It doesn't matter if I've had Better for 10 years and I get a new job and I go have a procedure done and I now have Cigna. Cigna is always going to be primary. Always, always, always. There's no if, ands, or buts. You cannot use that. The only way that that rule stands is if I had 2 commercial insurances or 2 of the government subsidized insurances. So if I had like Medicaid and Ambetter, it's whoever you have the longest. If I had Blue Cross Blue Shield or United Healthcare, it's whoever you've had longer. But in the instance of a job provided insurance, a commercial insurance like Cigna, and then you have a government subsidized Ambetter, the Cigna is always first. Okay? And now I've had to argue with 3 separate people about this. And it's simple. You look this information up online. Okay? But what chaps me more than anything is that we are now April, May, June, July, August, 5 months out from my hysterectomy, and you've already paid the claims, and you're wanting to not only get the money back from the hysterectomy that you already paid for, but you're going all the way back to September of last year and you're asking for your money back. No. I'm done playing this game.
If you think that the government failing to extend the ACA expansion isn't going to affect you because you don't get your health care through the ACA marketplace, I really want you to hear this. First and foremost, healthcare costs impact the entirety of the healthcare market. So even if you have employer-supported health insurance, you are still going to feel a shift. Your cost absolutely is going to go up. When insurance companies increase costs, like let's say here, because ACA expansion is no longer going to exist, they are still going to continue to raise prices for people who don't get their insurance through the ACA. That is just simply how the market works. And as people can no longer afford their insurance premiums, they're going to start dropping their coverage, which means insurance companies are going to raise everyone's premiums to make up for that loss. And for those people who do keep their policies, that means that they are spending much, much more for the same exact thing, meaning that they are going to have less expendable income on other things, which is going to have an immediate and direct impact to the economy, especially your local economy. And now that people will no longer have access to preventative care, they'll be turning to emergency rooms a lot more often, which obviously is significantly more expensive. And if they don't have the money, then it doesn't get paid, and the healthcare companies and the hospitals and everyone involved will continue to raise their prices to make up for that loss. Also, obviously, ER times, which are already insane, will continue to get worse and worse, which will lead to more and more burnout for healthcare professionals. So keep all of this in mind when your premiums or your cost of healthcare, any healthcare related expenses, continue to go up and up and up. And don't forget that when it's time to vote in 2026 or 2028 for your state senator. Because in Oklahoma, James Lakeford and Mark Wade Mullins voted against this, voted against expanding or continuing the ACA expansion.
So did we all just move on from our health insurance premiums skyrocketing? The deadline is in 3 days for us to pick if we want to have health insurance for next year or not, if you're self-employed like me, or if you're using these subsidies like millions of other people. I saw there was some votes in the government yesterday. Of course they didn't pass, and I guess that's it. I guess this is just what we pay now. When I tell my friends outside of this country what I'm about to be paying a month for health insurance, they're just shocked. Some of them are telling me what I pay in a month, they don't even pay in a year. I have a very strong feeling that a lot of people are just going to say, I can afford health insurance, which, you know what, I totally get, because who can? But what happens is if no one pays health insurance, I think then everyone else's health insurance premiums go up, right? If someone like in the know could explain this better to me, because I don't know. The way I understand it is this is not a good thing. Less people are going to go to the doctor. They're going to show up to ERs more sick than ever. There's going to be longer ER wait times. That's going to push the prices up of going to the hospital. I think this is the beginning of a tailspin, because as it stands right now in the United States, millions of people are forced to make a decision within the next 3 days, pay an exorbitant amount of money a month for health insurance, and most of the time for a plan that is not helpful, or just go without it and roll the dice.
What are Americans supposed to do? This is not quite political, this is healthcare. So scroll if you don't want to hear it, it's fine. So I'm an American, born and raised. I've been paying roughly $600 a month for healthcare. I'm healthy. Look at that. Look at this chin. Beautiful as well. And there's not going to be any type of extension on the ACA Obamacare subsidies. So, yeah, they're going up to roughly $1,900 a month for worse healthcare with a very high, like, I don't know, it's $6,000 or $10,000 deductible. I forgot. It just made me sick. The irony. So what are Americans supposed to do? Because I'm sure most people can't afford $1,900 a month. I know a lot of people I know are saying their premiums are tripling, just basically just like mine. in a couple of weeks because there's not going to be any type of extension. One party says, hey, let's extend for the next 3 years and fix this system. The other party says, no, Americans can pay triple. That's basically what it is. I don't care what your political view is. I don't want to pay $1,900 a month. I want the healthcare system fixed. I see other countries around the world that don't have these issues. And I generally think that healthcare companies should not be allowed to donate any money to any political fund, ever.
$935 for a high deductible plan for my daughters and I to be on my own employer's health insurance. I'm a teacher. I should not have to have 3 jobs to just pay health insurance. My district is raising my premiums $300 a month, so I'm going from an already high premium of $630-ish to $935 for the lowest plan. This is high deductible with high deductible co-insurance, co-pay, just to be idle. They want to take 1/5 of my salary. That doesn't include dental, that doesn't include vision, and that's just for me and my daughters. That is criminal. That is freaking criminal. All of that, and it's not even good insurance. It doesn't even cover my daughter's thyroid medication. It doesn't cover GLP-1 medication for the intended diagnosis that it treats, but with an FDA freaking approval. They're taking that away in January. How do y'all keep voting for this? How are we here? I'm a widow, a single mom. I work all the hours. I have a part-time hustle. What do you want me to do?
So the health insurance marketplace just opened today here in Oklahoma. And I just went and looked up my current plan, and it's going up by 160%. I can't afford that. We knew this was coming. I don't know why I'm surprised. It was just shocking to see it in black and white. 160%. So I knew this was very likely, but I'm not going to have health care next year. I'm 57, I'm healthy, but all I can afford is the catastrophic care. This is the richest country in the world. But my government doesn't care about me. My government doesn't care about my health care. Again, I knew this. I'll make a longer video later when I can deal with it, but yeah, reality set in.
I found out today from the marketplace that instead of paying $650 a month for health insurance for my son and me, I'm now going to be paying with my current plan $1,151 and some cents per month for my monthly premium. And my deductible is increasing from $1,500 to $4,000. I'm self-employed, so I don't have the option for employer health insurance, and I'm a single mother, so I don't have a spouse I can get health insurance from. And you would think if monthly premiums are doubling, surely my pay would also double from the health insurance companies, but unfortunately that isn't how it works.
This is America. I am 60 years old and have no health care. None. I'm helping take care of my parents, so I had to take a leave of absence from my job. The Affordable Care Act for me is $472 a month, and I surely can't afford that with no job. And I just want you to know there's a lot of us out there.
You guys, I called to get a quote for an MRI today. My daughter may need one of her knee for a sports-related injury, and the cost was more expensive running it through insurance than it was for cash pay. And these providers are under contract not to tell you that it may be cheaper if you ask to be a cash pay patient. You have to ask that. I called, so as not to raise any red flags, I called 2 different providers. One of them I ran it through my insurance. One of them I asked for a quote for a cash pay. And this infuriates me. Insurance is a scam and people don't know what questions to ask. It's crazy. I'm seriously thinking about abandoning our health insurance and going with a health share, one of these health share plans.
My feed's totally filled with the cancel your health insurance videos. I saw a video of a lady, her health insurance premium through work went from it was like $250, basic gist of it, $250 to like $750 a month. And she was saying that, can't afford it, which I totally understand. That's a $500 increase per month that she did not budget for, which I totally understand. But somebody please explain to me, because I'm watching all these videos, somebody please explain to me how, and nobody will answer me, what happens if you don't have insurance? Somebody's like, put it all into a high yield account. But what happens if you have something catastrophic, or not even catastrophic, but just like unexplainable, like this? I have a heart monitor because I passed out while I was sitting on the toilet. I was not drunk. I just, my friend's a nurse and she said, yeah, your blood pressure just went. I have high blood pressure, and all of a sudden my blood pressure decides one day that it's just going to completely bottom out. I don't know. So if you're one of those cancel your health insurance people, what do you do for things like this? Because clearly something's wrong. Normal people don't just pass out while they're sitting down. So please explain, what am I missing? I don't understand.
My husband and I just applied for our health insurance. It is more than majority of people's house payment. It's unreal. 2 humans, 52 and 54, no children on it. I about crapped myself. People can't even afford to have health insurance. Are you kidding me? This can't even seriously be real. I mean, we have to have health insurance, but after you pay that much money, then you pay a deductible, then you pay co-pays, then you pay for your prescription, and then you pay a percentage if you end up being in the hospital. I mean, it's a decent house payment in Oklahoma. Mind flippin' blowing. I mean, I don't know. I can see that maybe for a family of 5, but yikes. This is why so many people go without health insurance. I mean, I totally get it. And not that I didn't know people did that for a reason, but it makes you want to chance it until you end up with cancer or a heart attack or something like life-threatening, and then Anyway, we're going to pay it because what are our options? I don't know.
So I just went online to check my health insurance, and my current premium right now is $292 a month. Starting January 1st, it's going to $458. That's almost as expensive as my car note. So, what are we doing? What are we doing?
My health insurance is around $550 a month for just me. And I'm really thinking of taking myself off of health insurance. With my car insurance, if I get into an accident, I have PIP. And I feel like paying out of pocket for the occasional blood work or medication that I need is appropriate. At this point in my life, I've resolved a lot of my health issues, and I feel like right now I'm still paying out of pocket for a doctor who doesn't take health insurance. And I really just have health insurance for peace of mind. But at this point, I'm just kind of $550, and that's not even that's the beginning. That's almost $8,000 a year. It's just so much, and I want to be able to spend that money either in savings or investments or other places. But $550 for bare minimum stuff and for care that is just symptom treating and not preventative or anything else like that seems kind of crazy to me.
So if you've taken yourself off of health insurance and you don't have health insurance and you're just paying things out of pocket, I would really love to hear your perspective. If you have done that and you regretted it, please let me know as well.
I'm a doctor and I'm really concerned about what's going on with healthcare premiums and healthcare insurance right now, and especially going into the next year. I just went to pick up a routine medicine that I've been on for years at this point. Usually just get it and leave, but this time the pharmacist was like, oh, by the way, I ran the medicine with your insurance and I ran it as a self-pay, and I actually saw that it's 50% cheaper if you don't have insurance, so we'll use the coupon price and save you a bunch of money. I was like, that's super weird. I've been taking this for a long time and I've never had that happen before, where the self-pay price was actually significantly less than my health insurance negotiated price of medicine. And I feel like it just highlights a trend that I've really been seeing in the office, where one, I have a lot of patients I've noticed are starting to actually not get health insurance because it's just cheaper for them to negotiate a self-pay price or use the self-pay price in the office, as opposed to paying hundreds to thousands of dollars every month for a once-a-year visit with their premium. The other thing I've noticed a lot that's really worrying me is I'm having an alarming number of patients who are being suddenly denied medicine that they've been on for, again, months to years, especially some of the more advanced medicines, like what we call biologic medicines, to help with things like eczema or psoriasis or hidradenitis. I'm documenting that they're doing well, that they're getting better, the medicine's working, and then out of the blue, the insurance is like, screw you, good luck. They're not getting this anymore because some drug company negotiated a better price with us. So now this is what we want them on. And it's just so awful, so awful. I'm really worried about what's going to happen in the next year plus. I think what's going to happen is more and more people are going to start to choose to be uninsured and just take a penalty if it's there, because it's cheaper in the long run than doing what we're doing. But the problem is that ends up continuing to then drive up prices for people who are insured, because insurance is like a pool. So if there's not enough people paying into the pool, they're going to raise premiums even more. Not to say that these people are doing the wrong thing. I mean, they're completely reasonable in doing this. It's just it's a much bigger issue than I can solve. It's a awful thing. And I just wanted to highlight it because it's really bothering me.
You need to opt out of your insurance plan. Don't even bother with the rate increase. Just get out. In 2018, I was like, this is ridiculous. So I had a grandfathered plan from Anthem Blue Cross that I got in college, and Obamacare ruined my insurance, right? I got tired of paying the premiums, and I never used it, but it would go up anyway. So I finally was like, yeah, I'm done paying for this. I'm an entrepreneur. I could put that money towards other things. I canceled my insurance. It actually happened because I used to practice Ashtanga yoga and I'd subluxated my knee and it hurt so bad. So I called the insurance company and I was like, okay, how much would you cover if I were to get a cortisone injection? And they're like 70% once you meet your deductible, which was $3,000 at the time. And I said, well, I'm nowhere near my deductible. So again, how much are you going to cover? And they repeated themselves like a broken record. They're like 70% once you meet your deductible. And I was like, okay, got it. So I'm covering 100% of your costs, the doctor's costs, everything until I get to this deductible. I was like, that's bullshit. Cancel today. Just cancel it. One of my friends is actually a spine surgeon, and I just called him. I texted him and I was like, Jazz, can I just come in and get a cortisone injection and just pay cash for the visit? And he's like, yeah, totally. So I come in, and the fee for the visit was $220. He didn't charge me for the injection. He's like, I'm not going to charge you for this. He's like, you paid the office visit. Who cares? Whatever. If I had gone through insurance, though, that would have cost me over $1,000, that same injection. So I have plenty of other stories of just bullshit like that. But anyway, I decided right then and there to cancel my insurance. And then fast forward a year, I was assaulted. So in 2019, I got assaulted. And I'm like, okay, I didn't go to the ER. I was so traumatized that night. I woke up the next morning and went to a quick care. So then I get x-rays, CT scan, MRI, doctor visits. And do you know that in total, all of that didn't even come to $600. I was paying $400 a month for my premiums before. and $600 in medical costs. Now, I continue to see chiropractors and TBM practitioners, but even then, we're talking like 15 G's total. Like, and that included my therapist. So like my attorney on this case, because we pursued it civilly, he's like, we can't go for medical paid. You don't have medical. Now, if I'd gone through the insurance, they could inflate that and inflate that and inflate that. But, you know, my point is that, like, I was assaulted and I'm getting my CT scan was $99. My MRI was $199. And, like, in 2014, I got an MRI on my knee and it was $400 with insurance. It's a racket. Stop paying it. And the other thing people don't realize, like, a lot of times people will say, well, what if I'm in a car accident? Like, that's like their big thing. Like, they're not even so much worried about health, but they're like, what if I'm in a car accident? Car insurance covers medical. Like, car insurance covers medical. And you can have your own car insurance cover medical, even if you're afraid that theirs won't. So that's another alternative. You know, they have to tell you, if you go to the ER and you say, what is the cash limit on the visit? They have to tell you by law, right? So you can go in to an emergency room, wherever you live, you can actually do the research. You can be like, okay, if I go to the quick care, if I go to the ER, what are their cash pay limits? So that you know, like, out the gate, like they can't just charge you. And the only way they can even extort and bill you drastically is through insurance. Like, that's how they get away with that. But if you don't have it, they don't have any recourse to overbill you. Opt out. Like, the system, we keep saying we want reform, but, like, they have no incentive to reform if we're still paying them. Opt out. Even with your prescriptions, like, I pay less with GoodRx than I paid with my insurance. GoodRx is cheaper and offers better prices for antibiotics or fluconazole if I need it than when I had insurance. It's so insane. Opt out.
The response to my video calling health insurance a racket, which it is, all insurance is, was overwhelmingly incredible. So many people are on board. And I wanted to point out that so many people that work within the insurance industry said cancel it. They confirmed that it's a racket. I mean, I don't know what more confirmation you need.
Insurance is such a fraud. United Healthcare should be ashamed of yourself. I pay $3,200 a month for my family of 6. Every month, we hardly use any services, and I just got quoted an outrageous number for my 5-year-old to get his tube revision surgery. Might I mention, he can't hear properly. He can't speak properly. It's crazy that I pay so much every month. I could have paid for the surgery out of pocket.
You want to know why I am so worried about health insurance costs next year? We got just a new poll today, just dropped, about what people are going to do if their health insurance costs double next year. And it's so bad, you guys. Okay, so this is about the ACA marketplace. This is where about 24 million Americans get their health insurance, and we all know there are these enhanced tax credits that have been helping people afford their premiums, but they're about to expire because Republicans won't extend them. So KFF, which is a nonprofit, nonpartisan health policy research organization, just released a poll where they asked marketplace enrollees, what are you going to do if your premium payments double, which is the minimum that they will do? And the answers are really alarming. 1 in 3 people said they would very likely shop for a cheaper plan, which sounds totally reasonable, except that those plans will have way higher deductibles and copays. So you'd be paying less up front, but way more if you actually need to use that insurance. And the really scary part is that 1 in 4 people said they would very likely just go without insurance entirely, just straight up uninsured. 25% of the people, that's over 5 million people. And get this, nearly 6 in 10 people said they can't even afford a $300 increase per year without it seriously disrupting their household finances. That is $25 a month that people cannot afford. The poll also asked what people would do if their total healthcare cost, premiums plus deductibles plus copays, went up by $1,000 next year. 2/3 said they would have to cut spending on daily household needs. Half said they'd have to try to find another job or work extra hours. 4 in 10 would skip or delay paying other bills. And a third said they would have to take out a loan or rack up credit card debt. One more thing that's actually kind of hopeful is that 84% of enrollees across party lines think Congress should extend these enhanced tax credits. That includes 72% of Republicans and MAGA supporters. So there is broad support for keeping health insurance affordable. Not that Republican Congress members care. Anyway, open enrollment is happening right now. People have until January 15th in most states, but if you want coverage starting January 1st, people need to enroll by December 15th. So this is all happening like now. And the bottom line, I will just leave you with this, is that a lot of people are about to make some really tough decisions about their health coverage. And the results of those decisions are going to have extremely negative impacts on all of us.
Hey guys, so guess what I did today? I had a meeting with my insurance lady for open enrollment, just for her to tell me that my premium was going up from $469 to $2,200 a month. She said I had until December 15th to let her know if I wanted to cancel. I said, oh babe, I can tell you that in 5 minutes. Just cancel it. So I want to tell you what I'm looking into now, okay guys? I'm looking into direct primary care. Google in your area what clinic offers that. Call them, get the information. The next thing I'm doing is looking into something that would help me cover like a major medical expense, which would be like a health share plan. Please drop in the comments if you have experience using these. I'm looking at Zion. The other option I'm thinking about doing is putting that $500 that I've been paying in premiums into an account and using that to self-pay. So if your insurance premium has went up, comment below and tell me what you're doing.
We have not had health insurance for 3 years. This is the reason why I can be a stay-at-home mom. Prior to having kids, I was a nurse. I had the big benefits. I had the big paychecks. When I got pregnant, I wanted to keep working, but I also knew in the back of my mind that I wanted to be at home with my kids. It would be so painful for me to go back to work. I think I would have a complete mental crash out. And so we sacrificed. We sacrificed the benefits. We sacrificed the big paychecks. My husband owns his own business, so he doesn't have benefits. And we couldn't afford private benefits. So we're uninsured. And it's been the best decision we've ever made. Self-pay discounts, huge. We have 2 kids now. I've had a whole labor, prenatal appointments, labor, delivery, postnatal appointments, all that uninsured. I have 2 toddlers. They have well child visits, all that. Self-pay. The biggest question people have is like, what about an accident? We signed up with a group called Crowd Health. Now, this is not an advertisement. Crowd Health is everything to us because I get to be a stay-at-home mom because of Crowd Health. It's a self-funding group. You pay a very minimal amount to each month. It's significantly less than paying for private insurance for a whole family of 4. If you guys want me to talk about Crowd Health and all the benefits of that and what they actually do to support you if an accident were to happen, I certainly can. Let me know. Just saying, health insurance, you better watch out.
We dropped our insurance in December because we were paying, and this is pretty low, okay, and I'm self-aware. But we were paying around $600 for our monthly premium for our family of 5. But our insurance was not covering anything. It was a high deductible plan, and it wasn't going to literally kick in until we paid like $5,000 out of pocket. And it would cover like wellness visits. It would cover some labs once per year. And that was like it. But last year, it wasn't covering like an orthopedic visit for my son breaking his thumb, like any of that. So I'm like, what is the point of me paying for insurance if it's not even going to kick in until I fork out $5,000 on top of me already forking out $600 per month out of my paycheck, plus it requiring me to fork out money into my HSA. Okay, so instead we just canceled it, and we are trying to put money into just a savings account for any time we have to go to the doctor. And we went to the doctor for the first time in February for my son who had a sinus infection. Okay, so we go, and I knew that we were going to have to pay an office visit fee because we are self-pay. We pay $100 for an office visit, okay? right when we get there. And I say, okay, great. Pay the visit fee. Awesome. My doctor was able to fill our prescription in office for the antibiotic right then and there. $15. $15 because we were self-pay. Okay, so now I'm $115. I've had a sick visit, which was necessary because he had a really, really bad sinus infection. His ears were infected. He had a sinus infection. It was a whole thing. Okay, $115. This would have cost me probably $150 because of a sick visit if I had insurance. But let me tell you, I just got a bill in the mail saying that the total charges were $260. $260 if I had insurance. And this is what they were going to bill to insurance. She said, I call her and I was like, I'm confused. Because number one, it said charges $260. Patient payments was $70. Okay, this is what it's saying right here. Okay. Patient payments $70. That's false. I paid $100 in office. Insurance payments $0. Well, duh. Patient balance $191. Okay. So I was very confused because I was like, well, that's incorrect. So I call them and I'm like, hey, I got this bill. And I gave her my son's name and she said, I know what happened. What insurance should we be billing? And I said, we don't have insurance anymore. We dropped it and we are now self-pay. And she said, oh, that's perfect. So your remaining balance is actually $17. $17. So my total bill for the office visit was $117. $117 for a sick visit. So let me get this correct. My self-pay cost is $117. But you are going to charge insurance $261. And my insurance would have probably still charged me $150 for this visit. Or not charged me, would have just said that my patient responsibility was $150 still. And then I would have gone to go pick up my prescription for my son and it would have probably still been maybe $15. Maybe it would have been about $7. Just depends on the medication and the brand or whatever. This is why we are self-pay. And I didn't even have to pay my $600 premium this month. So, explain why. Okay, I looked up actually a past bill from the last time that we had a sick visit when my kid had strep. $180 was my patient balance after insurance. $180 plus the strep screening, which was an extra $30, which we didn't have any extra tests because it was just an infection. So we didn't have that this time, but $180. So for that sick visit, my patient portion, $210 with insurance.
I just gave birth 2 months ago and have received all the bills for it. So this is how much it costs to have a baby in the United States, specifically Washington State. A little preview, I had a low risk pregnancy. I had a vaginal birth. I did get the epidural. I only labored at the hospital for about 5, maybe 6 hours. And in total, I was at the hospital for 36 hours. Starting off, the labor and delivery room, I was there for about 16 hours, was $15,784. Yeah. My daughter decided it was time to wake up from her nap, but moving on, my postpartum room was $6,256. Now, it was a private room, but my hospital only has private rooms. They don't have any shared rooms. I was first shocked that this was a separate charge, but the 11 minutes of pushing that I did cost $3,261. That's like the doctor-specific charge, which, okay, whatever, my doctor was amazing, but sort of crazy that's not included in the labor and delivery $15,000. They did about 6 blood tests on me, and that cost $906. Pharmacy was $1,124. This includes like Tylenol, ibuprofen, prenatals, Zofran, and the medicine for the epidural. The epidural itself was another charge because it's another doctor that you have to pay. It was $2,160. It's crazy the epidural cost that much because I only had it for like an hour. I got to 9 centimeters and was like, yep, can't do this, I'm medicated, I need the epidural. But $2,000? Crazy. That was only for me. We also have to go into the charges for her. Her admission to the hospital cost $4,429, and of that, $3,743 was just a charge that said nursery. Like, what nursery? She stayed in the room with me literally the entire time we were there. Next, there was a charge for her that was this label of physician services. It was $552. I'm assuming that was the 2 times they came into the room, saw her for 30 seconds, and then left. The last charge finally is a hearing test for her for only $28. So in total, all of that was $34,500. Luckily, health insurance exists because out of pocket, we only had to pay $350, meaning our insurance covered $34,150. I think that's insanely ridiculous, but that is how much it costs to have a baby in the United States.
I have said it before and I will say it again. Health insurance is a scam. It's so hard for me to shake you guys to make you understand that you are stuck in a system of sick care. It is a business model. It is not to keep you healthy or to get you well. It is a business model, a big business model that is a hamster wheel that they get you stuck on. So how do you break out of the system? Get rid of your health insurance. I haven't had health insurance in over a decade. I pay my own way. I always say cash pay, that confuses you. Debit card, credit card, it doesn't matter. I mean, I am self-insured. I do not use health insurance. We pay as we go. The rates that you think you would need to pay if you walked into an emergency room or into the hospital or whatever, they're not the real prices. This is what you guys need to understand. You need to negotiate. You need to negotiate. You need to pay a normal, respectable amount for the services that you receive, not these crazy inflated prices. I wish I could explain all of this to you guys. So I live in Texas and we do not need to have health insurance. Trump got rid of that Obamacare mandate in 2020. If you live in a state that still requires it, and there are a handful of blue states that do, I know Massachusetts is one, I know California is one, and there's a few others, pay the fine. Just pay the fine. It's still gonna be cheaper. And then you take that money that you would be paying, you know, $5,000, $10,000 a year, whatever you would be paying, you take that money monthly and you put it into an account that you use for your health and wellness. And you can go see whoever you want. You go to functional practitioners, you do what you need to do. You probably don't even realize, like if you needed an x-ray, go online and there are, you know, like radiology centers and websites, and you just order what you need and go get it done. It's not that expensive. The last time I got an MRI for something, it was like $450, and I recently had a thyroid sonogram done and it was like $225. It's not that much money, and it's way cheaper than what you would otherwise pay. You go to the hospital for whatever reason, tell them you're cash pay. They have to give you the pricing before they even start any stuff, and you'll see that all of those inflated bills that you're used to seeing, that's just all fake. That's all part of the insurance scam. And you all don't need to participate in it anymore. I know this always drives people crazy, and I make these videos and I wish I could explain to you more, like they have to treat you and you don't have to pay the bill if it's outrageous and it's, you know, extortion, so to speak. You will negotiate, you will pay a reasonable amount, you will go see practitioners who are called like direct care or functional practitioners. You will do telehealth online, everything, even your prescriptions. I don't see a doctor for my HRT, for my progesterone. I get it online at All Family Pharmacy. There are so many ways around all of this stuff.
Fun fact, for the beginning of this year, 2026, I canceled not only mine, but my son's health care. All of our health insurance, our health benefits, everything through my big girl corporate job, because not only did we get a nice hefty deductible added, our cost out of pocket went up almost 30%. No, thank you. I am not buying into this. Now tell me why. Tell me why. I just downloaded GoodRx. I went to refill all of my scripts. Tell me why prior with my insurance, because I'm on a lot of meds, guys. I'm on a lot. Just to maintain this mental status, okay? Tell me why prior with my health care, with my benefits, that I was paying an astronomical amount for out of pocket. Like, you guys don't even know how much I was paying out of pocket, okay? I think a lot of people just assume that it's good and affordable. No, it wasn't. Prior to, I paid about $50 a month out of pocket for my prescriptions, just my regular monthly prescriptions. Tell me why it's now $8. Now, I'm already aware, everybody in my life, friends, family, coworkers, my husband, everybody thinks I'm insane and crazy, but like, I'm not. I'm not, I promise you. What my new out-of-pocket cost would have been just to have insurance, just for me and my son, nothing crazy, nothing grandiose, nothing top tier, just basic coverage was going to be almost $1,000 a month. That does not include out-of-pocket expenses. That does not include the new deductible that was added. That is just basic coverage, what's coming out of my paycheck. And I am refusing to participate, no. And before I canceled, I called my doctor's office, my son's doctor, my gynecologist, for example, and just said, what is the out-of-pocket, the self-pay? What is the self-pay option if you don't have insurance? You guys would be baffled if you knew how little it costs to do self-pay. So all's to say, this is the first time I'm refilling any of my scripts for the year 2026. And in my mind, I prepared myself to pay, I don't know, I guess I was in my mind thinking I'd pay $250. Like, just in my mind, that's just what I was assuming I would have to pay for 3 of my prescriptions. This is 3 scripts, okay? Not 1, not 2, 3. In my mind, I was thinking $250. Like, that is what I'll have to pay out of pocket. And I was okay with that, okay? Okay. And please, nobody come to me about a catastrophic event. Please don't. Don't be dumb.
When I tell you about the health care that I experienced in Turkey, you're going to wonder what the fuck is going on in America. We flew to Istanbul because I have a chronic illness. I have some health problems related to that, and I can't get our insurance to approve any of the tests that I need. We went to Istanbul, we pulled up to the hospital. In 2 days, I met with and was tested by neurologists, cardiologists, pulmonologists, whatever ologists they could find, talked to every single one and was tested by every single one and was presented with the results by every single one that day. Nurses weren't examining me, it was the doctors that were examining me. Nurses weren't doing the ultrasound, it was the doctor doing the ultrasound. And he was telling me what he was seeing while he was doing the ultrasound. What? Oh my God. You know, the first time that you ever go to Chick-fil-A and you're like, this has to be a joke, why are people so amazing? That's pretty much everybody but America is the Chick-fil-A of healthcare. Each doctor has their office. Half of the office is this nice little like desk and x-ray. You can see the things and the stuff. And then you walk around this little partition and their exam table is right there and they just do the examination right there. This is going to blow your mind. So one of my test results came back and it was a little scary and they didn't like the numbers. So guess what they did? They said, let's take you upstairs and just run a couple other tests. Didn't have to wait for insurance to approve it. Didn't even have to wait for them to submit it. They didn't charge me any extra. They took me upstairs and did the blood work and gave me the results. Why is my saying that such a big deal? Why does healthcare suck so damn bad in America? Why am I flying to other countries and getting the tests and the results that I need in 2 days, which is more than I've gotten over the past 10 years? Do better, America.
You know there's something wrong with the U.S. healthcare system when the fear of calling 911 and getting an ambulance, the fear of the price of that outweighs any help I might receive. I had to call 911 for the first time in my life in October and November of last year. Had an ambulance come out the second time. I had to get in the ambulance and go to the hospital. And it's March, and I'm still getting bills. I have health insurance, by the way, good health insurance. But I'm still getting bills from the city, fuel charges, $313 here, $95 from the ambulance company for a first responder fee. and all these bills that I don't know when they're going to end. And so now I have such a fear of calling to get help because I have no idea what it's going to cost me in the future. And something's got to change. I don't know how we do it, but we just fight one day at a time, keep trying, be the change. We'll see you.
So I saw a TikTok earlier of a mom that said she dropped health insurance for her and her kids and that it's a scam, and I wanted to jump on here and share my own opinion of it. Obviously this is just for me, so take it or leave it, but I have not had health insurance in a really long time. This is not dental or eye insurance, but like health insurance for primary care. I had to get off of health insurance years ago when I got a divorce, and I could not afford it. Like, it was going to be about $900 a month for me to stay on the care that I was on. And being a single mom, moving out, having my 3-year-old, 2-year-old, I couldn't afford that price. So I was like, I'm fairly healthy, let's just wait and I'll eventually get on it. Well, I'm still not on it. So since then, I've had to go to a primary care doctor for my blood sugar. I am now on a Dexcom. So when I went, I was so nervous, called the doctor, and I was like, I don't have insurance. How much is this going to cost me? It was $100 to go see him. And then to get a full blood work panel was $100. No bill in the mail later, no extra copay, no nothing. And then I went to Walgreens to get my Dexcom. They thought I was still on the insurance that I had. Okay, this is very important. They told me it was going to be about $200 a month for the Dexcom. And I was like, well, I don't have insurance anymore. I don't have that insurance, so what's it going to cost me? I was so nervous. I just left Walgreens for my Dexcom. Right here. $46.19. That's how much I paid for my Dexcom now without any insurance. And then ended up at the emergency room recently. Had a cyst on my ovary, so I had to get CAT scan, ultrasound, x-ray, IV, medication. Had me in there for like 8 hours. I think I was in the emergency room, so I was so nervous about that bill. Get on the hospital app, it's $2,000. So I'm like, okay, I'll make a payment. Close the app, got back on it later. I think it was the next day I got back on it. The whole bill was leveled out to zero. It said self-pay, no insurance. They leveled it out completely. I know that doesn't always happen, but I'm just letting you guys know. They leveled it out. And then yesterday I needed antibiotics for something, so I needed to go to Walgreens and get that, and the lady was like, oh, you don't have any insurance. I was like, no, that insurance doesn't work anymore. And she was like, oh, okay, well, I'll put a discount code in for you. That medication was going to be about $115. I paid $3.85. So I'm not saying that healthcare is a scam for everyone. If it works for you, it works for you. But I'm just saying that they charge a lot and it doesn't cost that much to get seen and cared for. I don't know.
Health insurance in the United States is a scam. So I finally made the decision about 6 weeks ago to cancel my self-employed health insurance plan because it got to be too expensive for pretty much no coverage. It would cover us for basically catastrophic. So I made the decision to cancel it for my son and I. 2 weeks ago, I ended up in urgent care. My son had an ear infection. And when I walked in, of course, I have no idea what to expect. I've always had insurance. I've always kind of known what it was going to be. So I walked in and I said, what am I looking at for a cash pay price? And she looked at me and she goes, oh, well, you can just get our own health insurance policy through this urgent care. And it's $190 today. It's good for a full year. And it's just a one-time fee. And if you have to come back during that time for your son, it's only like $120 a session, or a visit. Okay, so $190. And I said, what is if I don't use your plan and I just purely pay out of pocket? And she goes, it's $300. Okay, sign me up. So $190, my son got seen. And now until next February, he's covered at $120 for any urgent care visits at NextCare. Thank you guys. I actually really like that option. While we're sitting in the waiting room though, somebody came in, early 20s. He had health insurance and he asked the lady at the front desk and he goes, I just wanted to check and see what my cost would be out of pocket before I go ahead and get on the waiting list. Hands over his card. He has United Health Insurance. And she tells him, your copay for your urgent care visit is $450. He walked out. He goes, I can't afford that. So he is paying for health insurance, which guaranteed that is a hefty monthly cost, has a high-ass deductible, and he was told it was $450 for his urgent care visit with health insurance. And my son was seen for $190 as a self-pay individual, and we were in and out in no time. We went to Walgreens, we filled his prescription through GoodRx, and it was a whole $10. So I spent $200 for my son to be taken care of instead of the $1,000 that I would have paid for my monthly policy and the astronomical deductible that I would have paid. How is this our healthcare system? How is it so much cheaper to be cash pay? Then why are we bothering with health insurance? I am a mental health therapist. We accept insurance here. I despise it and I'm trying to find a way out, but I know some people need it. But our health insurance companies don't give a shit. They are upping their cost and they are lowering the benefits. This has to stop. But if you can do it, honestly, drop your health insurance because they will not ever make changes until their bottom dollar is impacted.
What we are witnessing is the collapse of an illusion. The insurance industry, companies like United Healthcare, Anthem, and Blue Cross have relied on our fear of catastrophic medical debt to keep us paying into a pool that offers less coverage every single year. But fear only works until the cost of the protection becomes more painful than the risk itself. People are waking up to the reality that a $10,000 deductible means you are effectively uninsured for day-to-day life anyway. So millions are turning to direct primary care, cash pay clinics, and health sharing programs just to survive. If a critical mass of the middle class actually pulls their money out of these corporate networks, it won't just hurt the bottom line of massive health conglomerates. It will force a reckoning that this country has avoided for a generation. Have you looked at your renewal rates for this year and are you considering dropping your coverage entirely? Let me know down in the comments what your premium looks like and how you are planning to handle your family's healthcare. Thanks for watching. I'll see you in the next one. Take care.